Good evening to everyone.
Good
Good
evening.
evening to our audience. Good evening to our wonderful health professional, mental health practitioner, public health professional. Welcome. I will start by introducing myself. My name is Cole Fangalo. I am the Executive Director for Community of Angels, and I'm also a health and public health practitioner. And I would give you guys the opportunity to please go around and introduce yourself. Thank you.
You want me to go next?
Yes.
Okay. All right. Good evening, ladies and gentlemen. My name is Keisha Hazlett, known as Nurse Keisha in the community, and I am too a public health practitioner and educator.
Okay. Thank you, Keisha. And
Go next. Hi, everyone. I'm Emma Bole. I'm an epidemiologist and researcher by profession. I've been a public health practitioner since 2007, so 17 years, worked across multiple pandemics. So not surprising, COVID-19, but Ebola and other pandemics and that we've come across. So I'm happy to be here to be able to discuss about impacts of COVID-19 on mental health.
thank you very much, Dr. Boley. And Dr. Pang, you can go next, or
Oh, I was going to wait for the lady to go.
okay,
But
Rachel, you can go ahead. That's fine. You can stay last. Rachel, you can go ahead.
It doesn't matter. My name is Rachel Sumo. I am a adult gerontology nurse practitioner and a psychiatric mental health nurse practitioner. Thanks for the invitation to be here. I love teaching and I love working with people and educating our community on things that matter. So it's my pleasure to be here. Thank you.
Thank you very much, Rachel. Dr. Pang, it's all yours.
Hi, my name is Sam Ban. I am a mental health provider here in the Twin Cities, and I'm happy to be here.
Thanks to you all for taking the time to join us today. This program was made possible through the partnership of the Minnesota Department of Health. We're in collaboration with them to bring in information about mental health and coronavirus into our community. Our aim today is to ensure that our community have accurate information, that we can link them to resources. We can clarify some of the misinformation that is going on about mental health, about corona, and how the coronavirus continue to have a negative impact on our community. So that is the topic today. And here with us are some health professionals and mental health professionals and public health practitioners here that can come in and give us some insights on that topic. Thank you for joining us and welcome to our audience. So we're gonna get started. So we want to start by talking about some of the misinformation when it comes to the coronavirus and mental health. How have the coronavirus what kind of impact does the coronavirus have on our mental health in our community? And what are some things we're doing? What are some strategies we have in place to fix that when it comes to mental health and mental illness and COVID?
I think you got to call somebody out and ask the question, or we are just going to wait and see who goes first.
And who can I call out?
All right, I will start, but well, coronavirus, the impact of coronavirus on, in fact, was global. It affected every community. This was one equal opportunity disease that affected the rich, the poor, whatever race you were. But on our community, it was especially hurtful in that, we come from a community of caring where when a person is sick, that's the time, the people that care for you because they will be there taking care of you. And then this disease came around, and when you got sick, you had to be quarantined, And so it had some psychological impact on the people as well. Because when you got sick, not only were you physiologically sick, but then you got lonely, you got deserted, you felt deserted by the people you care for or who you thought cared for you. And even those who have families that would not allow them to be quarantined, you felt guilty if you were the first person in that family. It's like you were bringing the disease to the family. So it had a lot of psychological impact. It was not just one of those diseases you got and then you pop up a Tylenol or something and then it got better. There was that potential that you were bringing it into your community or into your home. And there was that, factor of being quarantined, which also led to a bigger problem of being stigmatized because once people were able to put you in a little corner for about 2 weeks, nobody wanted to be the first to shake your hands or to speak to you or come too close to you because of, you became stigmatized. There was a lot of mental health discrepancies, and some people actually broke down after getting COVID because of those impacts, which was not that COVID did not directly cause it, but the impact of the illness on them led to something bigger, like a nervous breakdown or a depressive episode.
Mhm. Okay, yes. So Emma, I see you want to speak.
Yeah, I'm just going to add to what he said. Everything he said, I agree with it. COVID-19 did not cause mental health. We've always had a mental health crisis in this country and globally. It's just that COVID-19 made it worse and brought it to the forefront, and primarily because of multiple reasons, as he stated. People were isolated, they were lonely. Like he said, we Africans, we grieve together. So for instance, people lost a lot of people during COVID-19. They couldn't attend the funerals. They didn't go through the whole period of grief. And typically with Africans, we go through the whole thing. Everyone goes through the whole thing where you attend the repast, the funeral, you're there with your loved one when they depart the earth, and most people were denied that because of restrictions. And so people didn't have the time to fully grieve. The other thing that COVID-19 did was there were a lot of instability around jobs. A lot of people lost their work. People who had jobs where it required to go to work had to go to work and fight a beast called COVID-19, and we didn't have all of the information. They didn't have enough PPE. Nurses were at the forefront, didn't really have the protection they need, but they still had to go to work to feed their families. Other people lost their work because they just couldn't work from home. I mean, there are a lot of things COVID-19 have done, and I think and it has been something that it's gonna keep happening, except we have systems in place to be able to address it and have people give people spaces and areas to grieve. And then the last thing I would say before I turn it over is that people, for the first time in so many years with COVID-19, people had to stay home. And so there were a lot of instances of domestic violence. A lot of people are in marriages where they are always, on the go. They work so many hours, they don't get to spend time with their loved ones or their husbands. And so with COVID-19, people had to be in spaces with people that they were terrified of. And so they were in uptake in domestic violence cases. And so it brought a lot of stress and toll on families and communities. And so that's the last thing I will say before I turn it over to you guys.
Thank you very much, Dr. Boley. That was very powerful. Thank you. And we will hear from some of our other speakers.
And then in addition to what the two speakers talked about, loneliness, financial instability was one of the major factors that affected people, because being able to provide for your family and out of a sudden you can, it increases anxiety, depression, and all of those things. And then the more you're depressed, the more you're anxious, and all of mental health tend to occur, mental illness tend to occur. So that affected a lot of people. And even and then the stigma of mental illness. Now I'm depressed. What do? I can't tell anybody I'm depressed. So then what happens? Nobody seeks help. And then your symptoms continue to linger. It shows up in several different ways, and you just continue to suffer. So those were some of the impacts. And then like previous speaker talked about grief. People we tend to grieve together. We tend to spend time together. And then just the fear of death from COVID and the fear of being isolated. We're especially from our African culture, we're not used to being cremated. Some people got cremated. Some people got, they had to bury their family members without anybody else being there. I mean, those things just increase people's stressor and just some of those underlying anxiety just got escalated because of all of the impact. And then even post COVID, even though COVID still exists, but now we tend to, we're a little more lonely, or we spend a lot more time home than we used to, because a lot of jobs now offer the opportunity for people to work from home. So that time we had to socialize with our coworkers, to talk to each other, to do happy hour after work, a lot of people don't get to do that. And some of those things provide increase the morale at work, but it also decrease the level of work stressors. So we tend, now we're getting more exposed, and knowing all of that, we tend to see an increase in mental illness. I saw that just since the COVID, we have had 25% prevalence on anxiety and depression, and most of which are related to some of the factors we just named.
Thanks very much. That was powerful. Thanks you guys. So everyone had a very good insight. What I was hearing was we did a good job, identifying the issue, but in the African immigrant community, the African-born immigrant community, that's the population we're focusing on. When it comes to therapy, counseling, and getting help, sometimes and most times there's challenges, especially when it comes to mental health, when it comes to therapy. A lot of people in our community tend to find different strategies that they think may work to resolve, their depression so I just want to know, as mental health practitioners and doctors on here, what would be some of your recommendation? Because the aftermath, post-traumatic stress, and still exists. What are some of your recommendations, or what are some strategies that you have in place that you can tell the community about? How do we motivate the community to go and seek help?
I can start. We just have to continue to educate our community that mental health is equivalent to a physical pain, or high blood pressure, diabetes, one of those things, because it's easier as an African woman to tell you, oh, call the doctor diagnosed me with high blood pressure. But it's a shame to tell you, call, I've been so anxious lately, I can't sleep. And we know the risks of not being able to sleep because you're anxious. All of those going to increase or going to cause other physical complications, even the heart disease, the diabetes, and all of the other physical diseases. So it's about time that we continue to encourage people and educate. We might not be able to do everything within a short time, but if you have a family member who you suspect that is maybe a little irritable, or is having some changes in behavior, it's about time that we sit down and talk to them, because a therapist is somewhere. One of the ways I tell people, a therapist is a safe space. Somebody who is not going to share your business with anyone. And you know what? If they share your business with somebody and you can prove it, you sue them and you get paid for it. But that is a safe space where you can de-stress, you can share everything, and the person can help you work through your situations. And you may not necessarily need medication at the time, but somebody that can work with you, that is invested in your health and has invested in helping you grow to minimize some of the things that you're dealing with.
Mhm.
Mhm. Yeah, thank you very much. Yeah, so and there's different programs out there, and one service that Community Angel focus on is linking our community to resources. We have information on our website. We have an office space. If you go on our Facebook page, we will post different agencies that have free services. And if you don't have health insurance, there's organizations that can help to help you get health insurance, to apply for health insurance. There's a lot of government resources that we need to take advantage of. And I know sometimes as immigrants, people are kind of skeptical or shy to go and get assistance, but it's services that we work for and is available to us. So thank you very much, Rachel. And we're just going to move into our next questions. Vaccination hesitancy. The rate of vaccinations in our community is low comparable to other communities. And I just want to talk about what are some of the challenges, why, the number continue to remain low in our community when it comes to getting vaccinated. We want to talk about some of the challenges, some of the stigmas, some of the reasons why, and then we can discuss some strategies and some suggestion on how we can improve the rate of vaccination. How is the vaccination safe? How is it helpful to us? And we can start, anybody can start from there.
Let me, I'll chime in on this one in the beginning. I know that at least in the African-born community, we just don't trust, right? We don't trust the government. We don't trust because they've hidden things from us. They've given us things and said, this is not the case. So here it is, you're coming around with the vaccine and then you want to pay me to get it. So the first thing I'm asking is, well, what's in it? Like, what are you hiding behind it? Why do you need to give me something for me to get something? Right? So for us, African-born, and then the immigrants, it's like, well, I consider myself an immigrant too, but anyway, right? But the thing is, we don't trust, right? So what have they did to us, about us, in front of us, behind us, to cause us not to trust them? And the other conversation on that, especially in the classroom setting, where's the proof? It's like, can you prove that this works? How long has this been around? It usually takes years before a vaccine is deemed worthy to be given to human beings. Years. And all of a sudden, you mean to tell me just out of the blue, it's now good for people? Well, the community didn't buy it, right? So again, it goes back to trust. They just don't trust. So then, well, I can answer that other piece later. But the thing about it is, in order for us to trust the vaccine, it's important for people to be honest about what it is, what's in it, what's happening, and how it's going to affect us. And if you don't know, then say, I don't have all the answers. Don't cover it up with something else, which causes us again, what? Not to trust, because you're not being honest. Yeah.
Thank you very much, Nurse Casey. Thank you very much for that.
Well, she hit it on the nail, but there's a difference between distrust and paranoia, right? Most people were not paranoid. They distrusted the system because the system has, they use the people of color before, and not one time or twice. And even when it came out to say, hey, we can't believe you treated us like this, there was not really like some kind of good apology or restitution, like because we did this, we saw we wrong, and we will pay for it. It's always like they've treated the people of color like they won't treat themselves, right? So the distrust is not just about COVID. The entire medical system is not trusted uh, um, wholeheartedly by people of color because of the history of the system. But to add to that, we currently live in a very polarized society. Politics has now gotten into everything, so that if somebody was a Democrat and you were a Republican, anything the Democrat says is good is definitely bad. If you if the person was a Republican, you Democrat, whatever that other person said is definitely wrong, right? And we then even if entire families broke up because of how polarized the society has been. So there's no medication out there that comes with 100% effectiveness. Even the Tylenol we take, it works for some people, it doesn't work for some people. There are some people that have died from Tylenol, right? There's some people, ibuprofen works for them, and other people take it and it leads to GI bleed and stuff like that. We have never had to ask for proof before taking Tylenol or taking ibuprofen. We say, hey, this is good for headache, and you take two of them, right? And sometimes we don't even know if we're allergic to a medication. We say, take it, you take it, and then, you get hives or something before we notice, hey, you might be allergic to this thing, right? So there used to be this trust between the provider and the patient. But when society became polarized, then it's like, okay, um, if I believe this set of politics, then I only want to go to the doctors that believe the same thing I believe, right? So if I went to this other doctor and it says something, or this other nurse says something, but it's from the other side, I mean, we start to question everything, right? And so the vaccination became a victim of that. Now, why it worked as fast as it did, they used a completely different method for this COVID-19 vaccination than all the previous vaccinations, right? The previous vaccinations we had, basically, they took a weakened format of the same bacterial virus, right? The virus, they took a weakened format, they injected you with it. Your body beat the weakened one, and then it built antibodies so that when the real virus came along, your body already knew how to beat it, right? That's why it took some time and did that stuff. But this time around, they used a totally different method. So there was not enough time to even have good education around the new method and all that stuff that was going. I think the people that developed the vaccine this year, they got the Nobel Prize for chemistry. I think it was for chemistry, right? So it was a new thing, but because in the system there was already the lack of trust, and then the societies were polarized, it became more difficult for us to get engaged with the system as robustly as the other people did.
Oh, I would just piggyback on what he said, and he made an important point. I think trust is an important predictor of whether you get the vaccines or not, but also perception. Your perception depends on where you sit, whether you're at the table or you're not at the table. And so I would just give you a history of what the US has gone through. So back in the 80s, when we had the crack epidemic in the US here, what happened? Black men, they were put in jails and they were put in jails, okay? When the Black people were disproportionately affected by it, the society solution was to lock them up.
Mhm.
Mhm.
Fast forward to the 2000s, when we started having the opiate epidemic, okay, what happened? We started having investment into Narcan and all of that to be able to save lives, because now primarily the whites were affected by it. So when you
Yep.
have people who are in policies making decisions, they prioritize what they invest in. COVID-19 was very, very quickly done. The vaccination was done in 18 months because the investment that was made with COVID-19 has been unprecedented globally. No other vaccination had that resources to be able to invest in. The US government invested a substantial amount of money into COVID-19. And believe me, I have seen when people say there are capabilities to solve diseases, there are. The research exists. People choose to invest what they want to invest in based on their priorities. We have the
Yep.
resources to kill cancer, cure cancer. It's there. HIV, since 1981, HIV has been disproportionately affecting Blacks. But because Blacks are second citizens, it's not a priority. And so we need to be careful around people say, oh, the COVID-19 vaccines were created to kill Black people. Well, if that was the case, you know, they would have done that with HIV. Okay. The reason why COVID-19 was predominantly, you know, there was an influx of resources put towards, because like you said, it affected Europe, it affected the Americas, South America, and the entire global village shut down. And so there was this urgency to be able to address it, and they put vast amount of money into it, and that's why we got a vaccine in 8 months. Believe me, if there was willpower to solve TB, it would have been solved. If there's willpower to solve malaria, it would be solved. People invest in what's priority for them. And so that COVID-19 is a indication of when you have policymakers who are primarily invested in something, they make it happen. HIV is still there. 40 years later, people are still dying from HIV. More people, if you look at over 40 years, more people have died from HIV than COVID. But who cares? Because predominantly, it affects Blacks and other minority communities. So we are, like you said, second class. But when things are brought to whites, and then there's an urgency to solve it, like this opiate epidemic, you know, now I hear Narcan and all of this, we got to save lives.
It's available.
Yes.
You can even get it for free now. You don't have to buy it.
And at that time, what was the solution? To lock
them up.
men up. In New
There's so
York,
many prisons,
the
but
US has the highest incarceration rate. And
Yeah.
you understand.
I understand it gets really personal when it comes to that. I completely understand it gets personal.
You got Dr. Emma going now.
Yeah. Very good point. Lot of good examples. So yes, thank you very much for your insight. Yes, it hits home. I mean, like when we talk about vaccination hesitancy, it hits home. It comes from personal experience, a lot of personal experiences. So yeah, Rachel, you want to add on to that powerful statement after Dr. Emma there?
Passionate.
Yes, I think that both of them have said it all. The misconception, you know, safety, and efficacy of the vaccine, because we know that it takes sometimes up to 10 years to create a vaccine, and then now someone come with a medication within a year, within 18 months, and say this is going to work. And we had people right within our community that, because of the lack of trust, are saying, nope, don't do it, you know. And with our previous history of what have been done to us and our race, I mean, it just makes it look safe to not take the vaccine. But I think over the years we've seen how effective it has been, because since the onset of the vaccine, there has been significant decrease in people getting COVID. So we know there has been some improvement, and it just doesn't. It's not just about the Black race, but it's about everyone. So having a platform like this for our people, people like us who speak the same language, who look the same, I mean, using our us as a minority person, coming to a fellow minority and educating people about the importance of the vaccine may help reduce some of the hesitancy of taking the vaccine at this point, because this organization, Community of Angels, the Liberian Advanced Nurse, Advanced Practice Providers, other organizations coming up and educating people about the need for the vaccine and the benefits might be able to help every one of us in the long term.
Yeah, thanks so much. That was really powerful. And I like the fact that you said most time when you have professionals that look like us, our patient, and that we can share similar experiences and we have lived through it, sometimes it comes trust. It comes trust. And Dr. Emma also made a really good point. The vaccination is all about prioritizing. COVID-19 is a global disease. It hit globally. So it had to become a priority. There's resources there and there's time. People make time for what they feel that is a priority. So, people come from different places and different experiences why they don't trust the system. And that's a personal space, but as professional, it's our job to come out and educate and teach people. However, we cannot disregard their concerns. So the vaccination was created by a lot of professionals. It had been tested. It's proven to be safe. I have been vaccinated, and we encourage people to go out and get vaccinated. And if you've already done your vaccination, you can get your booster. And my next question is to talk about some of the complications. What, as health professional and practitioner working in the healthcare industry, whatever it's clinics, hospitals, we want to hear about some of your experiences for people that have not gotten vaccinated. And also, I want to hear about some of the complications of COVID, some of the long-term complications when it comes to chronic diseases. What are some of the long-term complications? What are some of the benefits of getting vaccinated? What are some of your experiences compared to people that have gotten vaccinated and people that didn't get the vaccine? What were some of your experiences and working in the field?
Can I just say this before we get started? I know, at least in my community, I'm an educator by heart, and I do a lot of global workforce training for the front line. And one thing we constantly talk about in our settings is educating yourself. It's one thing for someone to sit in a position with a title and have a priority for something. And they may say to you, a community, well, you have to get this vaccine, or you have to go here, or you have to go there. I think it's critically important for each individual to have their own mind, make their own decision based on what their priority is. Because it's one thing for someone with a title to tell me to do something, and that has nothing to do with the trajectory of my life. And as a matter of fact, it might make it worse because I didn't take the time to do my own homework. So for us as brown people, for us as immigrants, for us as African-born people, it's important for us to do our own homework.
Due diligence.
Don't even listen to me and take my word. Go and get you some books. Go and do some research. Go and ask yourself some questions. Get to some town hall meetings and begin to open up the dialogue so that you can gather your own information and come to your own conclusion. Okay?
Yeah.
All right.
I agree with you on that. And, a lot of us Africans, we're religious people. So I would champion my religious view, because the Bible said because of the lack of knowledge, we'll perish. A lot of times we make decisions sometimes not thinking that it is the best decision, but the info because we don't have the full information. How do we go to town hall meetings? Sometimes because of the lack of resources. I think it's about time that, like we are doing right now, take the initiative, since we are the knowledgeable ones, since we are blessed with the knowledge that we have today. And great that we can do Zoom, we can meet people virtually, we can communicate with people in several other ways to be able to educate them. Because if we just depend on people coming to us to learning and getting the information, they're not going to get the information they need. And then what happens if one person gets affected with the disease, they might spread it to another person within the household, and then it continues to go forward. So this platform that we have in other platforms, I think it's about time that we go to the people and not expecting the people to come to us. Because if we have a healthy community, that is beneficiary to us. Because if somebody maybe I live in Ramsey, somebody in Brooklyn Park is sick, I may be related to that person some kind of way through a friendship or something, and I may be affected one way or the other. So I really admire the fact that we're doing this with the intent to go to the people in the darkest and deepest corner where we can find them instead of depending on them to come to us. I think that is a great public health initiative.
Meet the people where they are.
Yeah.
All right. Here's how I explain when it comes to treatments or medication. Anytime you take anything at all that your body is not used to, the first reaction from your body is to fight whatever this thing is that you just took, right? That's what side effects are. If you swallow some, the first way men figure out how to kill themselves is to drink poison. So anytime you swallow something that your body does not recognize, like what is this thing you swallow, right? So like if you're having diarrhea, nausea and vomiting and fever and all that stuff, your body is trying to get rid of this thing you just took that your body does not recognize. And it can happen with any medication, from Tylenol to aspirin to the vaccination. When you take the vaccination, even the vaccinations we used to take before, which were like actual live viruses, it was that your body fought them. So whenever you take anything that you are not used to taking, there is going to be some kind of physiological reaction. But that just means your system is working. So if you took it and you had some little headache, some fever, some diarrhea or nausea, vomiting, it means your system is working. Your body is fighting this thing you just took. Normally, I tell my patients, those effects go away in 3 to 5 days. They just go away. Your body suddenly like, okay, this thing is not poison. It's not gonna kill us. It's been around 3 days, and those effect goes away. Now it's true there are other people that have adverse reaction, which is not the usual fever and diarrhea and something. And COVID-19 is not the only medication. The vaccination is not the only medication that has happened to. There are people that got liver damage just from Tylenol. I keep going to Tylenol because it's popular, right? The people that have bleeding, GI bleeding from ibuprofen, right? While other people take it. So nobody can guarantee when you are taking something for the very first time how your body is going to react to it. But the way to do it is not, well, then I will not take it, right? The way to do it is to say, okay, well, since I haven't taken this thing before, I want to take it like in a professional setting, maybe in a hospital. The directions of the vaccination say when you take it, make sure there's a professional and sit down there for at least 30 to 60 minutes, and nothing serious happens, then you can go home, right? Now, even the trust issue and the stigma we were talking about before, one of the things we need to do is to get involved, right? Dr. Bowley said earlier, hey, the people on the table are the one making the decision. And if we keep sitting back and letting them make decision for us, we will continue to be treated this way. So even like I went out there looking for Africans that will participate in the test phase, right? Because in the test phase of the medication, if only Caucasians go, then of course when the report comes, the report will only speak for how this medication treat Caucasians, right? Now, if none of us participate in the research and none of us participate in the testing, but we want to benefit from it, you know, sometimes things happen to us that they didn't know about because none of us participated in the research or the testing. And then when we come to enjoy the benefit, something might happen that practically didn't happen in the testing, right? Because none of us was there. So the encouragement will be like, guys, for example, personally, when it came to me with the COVID-19 vaccine, I I kind of like got the COVID myself, like intentionally. I knew somebody who had it, and I went there like, you know what? I know after reading the research and this thing, the possibility of it killing me as a young, healthy man, the possibility of killing me was little to nothing,
Yeah.
right? And then I needed to actually get it to, I had my own other reasons, but that was I was safe enough based on the record to say I can get this thing, it won't kill me, right? But that's what knowledge does. When you get the knowledge, it takes away some of that hesitancy. And the way for us to build trust within the system is for us to get more involved. Like you were saying earlier, Madam Fangalo, is like when you go to the hospital and you see an African doctor, you feel a little bit relaxed, right?
Yes.
But how are we going to get more African doctors if we stay away from the system? We need to get involved. We need to sit at the table where the decisions being made so that next time when they're ready to test people against their will, they won't be choosing us or our people because we are at the table.
Yes, thank you very much, Dr. Kwan. Thank you. We're wrapping up here. Um, Although the numbers are decreasing compared to, we have come a long way from social distancing, wearing masks and gloves, and the numbers are less than what they used to, but COVID do exist there, especially, you know, with the change of weather and the holiday, you know, coming in full circle, people are gonna be gathering and coming together, congregating, and so I just want to know, I just want to ask you all to say, give some advices or, you know, from your expertise, and let the public know what are some of your advice to people that have not gotten vaccinated. And there's people that most of us have COVID. I think I had COVID about 3 times. And fortunately for me, there was no major complication, right? But there are people that were hit really, really hard. I met a gentleman that became paralyzed from COVID. You know, some people are living on ventilator from COVID. Some people got COVID and they came out with a lot of chronic disease that they have to live with for the rest of their lives. So people are still suffering from the impact of COVID. Some people are develop chronic mental illness from COVID, from the trauma. And it go back to the question again from the beginning. When it comes to our African-born immigrant community, and that's the population that we are focused on, and people with disability. And working in this field as a public health practitioner, it's very challenging to convince our people, like Dr. Pan said, to come to the table. It's very challenging. There's so many resources out there. And being an advocate, I see that most time, majority of our people do not use the resources that is available to them. Like Rachel said too, we have to take this information to them. But how do we know that they want it? How can we work hard at building a healthy community? What would be some of your advice to some of your family or our audience that have not gotten vaccinated? What would you say to that? What would you tell them?
So let me just piggyback on your first question. How do we get people involved? I think human nature, when we know there's a problem, we want to do stuff. So I think just creating awareness about the prevalence of COVID-19 and other diseases in our community, but also going back to something Rachel said, that people often want to get involved, but they don't have the resources to do it. They don't have the time. They often have to work 2 jobs. And so making sure that when you are inviting people to the table, you have, means to compensate them. If they don't have transportation, you make sure you provide them. So often with that, when we're advocating for resources for our communities, we got to make sure that we're intentional around bringing people to the table. And then the last thing is when they're at the table, that whatever the participant, we need to be serious about being intentional around taking our recommendations and putting in their actions, because what we've heard is that often people are called to just check a boxes, and they will say things, and they will say these are some of the community-led solutions, and it falls on deaf ears. So we want to be careful about protecting our spaces and making sure that the people we serve trust us, that we're inviting them to the table to be actionable and providing them the resources to do so. And then your last question about vaccinations, how do we get people vaccinated? Like what Dr. Kwan said, just making sure that they're knowledgeable about the risks. Well, nothing is 100%, as he said. I'm not a clinician, but nothing is 100%. There's always side effects, but any side effect, it's way better than being dead. And so there's tons of research. There's evidence that COVID-19 reduces your likelihood of having a severe condition or dying. And so the probability of you dying from COVID-19, it's reduced tremendously with vaccination. I think when we are providing people resources and we are telling them some of the things, and the last thing I said, often mistrust, it's a huge predictor of whether you get the vaccination, okay? And why is it that people are mistrusting government? Because there's this history, but we need to contextualize stuff when we're talking to people. You cannot compare what happened in the 1950s to what's happening in 2020, okay? Times are different, the events, the circumstances are different. COVID-19, things happen quicker because it was prioritized compared to other things that happened in the past with the Tuskegee study, the syphilis study with the Blacks. Those are not prioritized. And so often when people are comparing apple and oranges, we as practitioners, we need to stop them and say, okay, yes, I understand you are concerned that COVID-19 vaccination was developed in 18 months, but these are the reasons why, compared to HIV or other diseases that's not prioritized. And so I think if we can do that, people will understand that this is an important thing. People invest a lot of money into it because they wanted to prevent deaths. And there's tons of evidence showing that COVID-19 vaccine is successful in preventing deaths.
Yes, and minimizing risks. Thank you very much. Anybody else have anything to add? So we are doing really good with time. Over the last 4 months, Community of Angel have trained and deployed over 140 community health workers, trusted messengers, to go out in the community to their friends and family to spread the words in the community. So we are, like I said earlier, we're in partnership with the Minnesota Department of Health. We're using family members, neighbors, and sometimes language barrier is also an issue because not everybody can go on CDC website to read about information or even listen to the news and hear what's going on. So we have to be our own advocate. We have to be, out there getting information and sending it out to our loved ones. And we hope way beyond the partnership with the Minnesota Department of Health, like Rachel said earlier. There's a lot of public health and community health groups out there. I think it's time for us to take the lead. Those of us that are blessed enough to go out and gain some professional knowledge to be, a source to our community. So if anybody have a closing statement or any words of inspiration for our audience and for our community, we'll go ahead. We are limiting this to an hour and not African-born immigrant time. Although this is the African
Well,
immigrant
CPT.
event, but it's not on the African-born immigrant time. It's on, I don't know, I don't want to say unfortunately, but yes, American time. So we're doing really good. So we'll just go around a few seconds and give us a word of encouragement, and we look forward to having you wonderful people back on here, and as we work together to build a healthy community.
All right, maybe I'll go first this time. I really wanted us to talk a little bit about what mental health is. Maybe we'll come back another
Next
time
time, yes.
because we just threw it out there, and people have different definitions or perception of what mental health and mental illnesses are. And we've also used the word trauma a lot tonight. And sometimes there's a difference between perception and clinical definition. But a clinical definition of trauma will just be anything that you've experienced or somebody very close to you, somebody you love has experienced that is still bugging you, right? After all this time, it's still bugging you. And people who have had these traumatic stress incidents, the incident keep coming back. Either you're dreaming about them, or in the daytime you're having flashbacks about them, or it's like you avoid certain people or certain places because of that incident that happened in the past. You can move away from that incident. It actually shapes your perception, like you saying, these type of people are this way because of that one experience you had that way. So the entire community or entire group of people, now that becomes your perception. It means that incident is still following you, right? That's what PTSD is. And then, but there's good treatment for that thing. Not everybody that comes to the clinic needs medication. Sometimes, so there are certain people that we can help by just affording them the opportunity to talk about what it is that's bothering them. And some people don't need medication. Some people need medication for just a short time. And then once the things resolve, they can get out of medication. But everybody needs somebody.
Yes.
And we are out here. I can put in a plug for myself. I just opened our first mental health clinic here in the Twin Cities. Come on
Congratulations.
down.
Yes,
Yeah,
congratulations.
yeah.
We can send out
So
referrals.
hey,
There you
we
go.
got
There is
we
a
got our
good
own place
resource.
where we can come and
Get
loosen
service.
up a little bit and get some of the help we need.
Okay, so Dr. Pan, where is your clinic? Can you give us information about your
Oh,
clinic? And
definitely.
maybe next time
I'll
we'll
put
give you
one on
some
your.
time to talk a little bit more about your service and location, and we can direct people there for services, okay?
Definitely. But we are called essentialcarecenters.com. I mean, that's the
Okay,
website.
wonderful.
The name is Essential Care Centers. And
Mhm.
you can Google it. You can see us. You can even schedule yourself on the website and come at your convenience. And then let's start talking. I tell folks, you don't have to wait till you have a breakdown before you come see me.
Mhm.
Sometimes it's good to come see me in your normal self so that when you break down, at least I know what your normal self look like,
Okay, I
right?
definitely will book an appointment. Why I'm normal, or at least that I think I am, right? Till I see the doctor.
Okay. All right.
Thank you very much.
You're
Rachel,
welcome.
do you have any closing words or inspiration for the audience?
Yes, thank you so much for having me. Just participate in provide some education to our community. Since we're focusing on COVID and mental health, I would like to stay with that for now. Want to encourage everyone in our community who have not gotten vaccinated to go ahead and get vaccinated, because again, we're back to our indoor season, where we're easily exposed. If somebody has COVID, we might get it if we don't take the vaccine. And the risks versus the benefit, the benefit of getting the vaccine is significantly higher than the risks. So just trust the process. Some of us have I got COVID once, and I don't have any proven fact that I have gotten COVID since I got my first COVID. So again, I can claim so many things, but I think the vaccine had a significant impact on that. So again, thank you for your time, and I just hope and pray for a healthy community.
Thank you so much, Rachel.
Thank
Nice
you.
having you. Thanks for making the time. We appreciate you. Dr.
You're
Emma?
welcome.
I'm gonna be short. And I just want to say that mental health is an important component of health. I think sometimes we disassociate mental health from health. And it's so important because if you're stressing about, providing from your family, sometimes people develop high blood pressure on that. And so it's very important to be intentional around mental health and protecting your spaces. I would just say that, risk factors for COVID-19 and how COVID-19 has exacerbated mental health is primarily grief. If you lost loved ones during COVID-19 and you were not able to bury them or grieve with them, talk to a counselor, talk to someone, find a safe space to be able to allow you to grieve for that person. If there's, stresses because of job insecurity or whatever employment situation you're going through, like the CEO said, there are a lot of resources within Hennepin County to be able to help you with social determinants of health, whether you need food, housing, temporary housing, transportation. There are resources to be able to help you to get back on your feet. And so we are just here trying to encourage people to be able to take care of themselves and talk to someone if there's a need to.
Thank you so much. Nurse Emma? I'm sorry.
Nurse Emma?
No. Nurse Keisha. Thank you, Dr. Emma.
Yeah.
Nurse Keisha.
So my closing remarks would be around one thing I love to remind people is that your mind is the most valuable thing that you possess.
Mm-hmm.
And your mind literally controls your brain.
Mm-hmm.
Right? So whatever you think about is what you become. If you don't like what you're seeing, if you don't like the information, once you go and get the treatment, the help, whatever it is that you need, coupled with getting somewhere and fortifying your mind. Because if you don't fortify your mind, when you sit in front of a TV or a clinician or anybody else that's trying to sell whatever it is that they're selling, and you don't have a made up mind and you're not stable in your own self, you'll start to follow wherever. Right? So fortify your mind. Make sure your mind is strong and healthy. Now, I have some ways in which we can do that. And my way is always the BIBLE. But everybody may not want to do that. But that's what I use to fortify my mind. Because I don't care what's coming and going. Guess what? I have the power over it. It don't have the power over me. Mm-hmm. And so when you yourself be able to stand in that space, and even if COVID do come to my door and knock and affect me, mm-hmm. I still have my mind so that it will not control me and take me out. So I want to leave you with that. Whatever you think about is what you become. So think about what you want to become.
Thank you very much. That was a powerful closing statement. I want to tell everyone, thank you so much for taking time off your busy schedule to come here. I follow you, most of you, and I know some of you personally, and we call people on here that we know are passionate about change and passionate about giving back and helping the community. So thanks to you guys very much. We'll be here once a month. and bringing education to our community, bringing resources to our community. And we just want to say thank you very much and have a good night.
Thank you.
Bye-bye.
Thank you.
For politics, entertainment, news, and business. And this is KMTV. We are on your screen, we are everywhere. The best online Liberian platform you have. Make the best use of it. My name is Frank Adams, and I endorse this channel.
When the issues of Liberia hit the news,
What is it that we, the Liberian people, want?
the Liberian communities in the diasporas are not left out. That's why Diaspora Talk is back on your screens on KMTV. In fact, the United Party is not cohesive. Be it social, political, economic, and other issues affecting Liberia and the diaspora Liberian communities.
I did not expect to even make it to Hollywood.
Joan Cyrus McGee and Nathan Charles every Monday, Wednesday, and Friday, 12 p.m. Central Standard Time, live on KMTV, Facebook, and YouTube.
I want to be arrested in the midst of my people.
As they discuss the issues blending the voices from Liberia and the diaspora Liberian communities.
The Liberian Business Association in the diaspora should be used as a vehicle for economic development in Liberia because no country can develop without a diaspora impact.
For sponsorship, call cell numbers 612-806-5896, 816-433-3979, or better still, email us at usakmtv@gmail.com. Diaspora Talk.